still talking about the coronavirus. A journalist, Richard Sudan, joins me now from London to tell us how the government of the United Kingdom is working to curb the spread of the coronavirus. Good to have you join us, Richard. Now, from what we understand, the UK government has now outlined an action plan on a possible coronavirus outbreak in the country. What more can you tell us about that?
So at the moment, what we do know, the government is still treating the spread of the virus at this stage at the containment phase, but they are definitely anticipating that the virus is going to spread. We've had statements both from Prime Minister Boris Johnson and the Health Secretary Matt Hancock in recent days, and they've essentially reiterated quite basic information about hygiene, people taking precautions, but there's also talk that if this does morph into a pandemic, there's talk of up to half the population potentially being infected. There's discussions about 1/5 of the workforce potentially being rendered unworkable. There's talk about doctors who are recently retired being called back into work. There's also, the government have said they've taken measures to stockpile key vaccinations and medicines for other related illnesses ahead of an anticipated difficulties in obtaining these things. So there's of course, the other side of it is the economic impact. The government has continually reiterated that they want business to continue as normal. People, for the time being at least, should continue to go to work. But they're definitely bracing themselves for the spread of this virus in the UK. I'm not sure the exact number now, but I think yesterday there were around 50 or so confirmed cases. The number's almost certainly going to rise. Of course, we've seen in Italy, for example, the closure.
So Richard, just allow me butt in here, because I know that there is a major challenge, which is the fact that a fifth of the UK workforce could be off sick during the peak weeks of a major outbreak. Now, how prepared is the NHS for this?
Well, this is a very interesting question. Of course, the wider context to the NHS is that it's been subject to serious cuts to funding over the last few years. And so already, really, even before the coronavirus, the NHS was already struggling to provide the existing service. The very fact that the government has said they would potentially need to recall doctors and nurses who are recently in retirement really tells you that they are going to struggle really to deal with these cases. Of course, there's the issue of the doctors and practitioners themselves potentially getting affected. So I think this could potentially be a major crisis for the NHS, which was already under strain from massive cuts to public services.
All right, just quickly, in a few seconds, just tell us what the government is doing in terms of travel advisory and restrictions.
So really what they've said at the moment is they've advised people to continue to travel within the UK as normal, to carry on social engagements, to carry on working as normal. They've advised people, of course, to refrain from travelling if at all possible, and to almost certainly not travel to the regions where cases have been found, which at the moment actually is most countries. So really the government at the moment is trying to just get people to continue business as normal, but it's almost a certainty that this could well spread further, become a pandemic, and so I think the government's advice will probably change fairly soon, I would have thought.
Journalist Richard Sudan, thanks for these updates.